begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life. Now finally, for those that have lupus and have been sending in requests that I speak on the topic and how acupuncture can help an individual manage this autoimmune disorder, well, here we are. Now, I'm sorry it took me some time to get to this topic, as I have a list of various disorders I've been asked to discuss for some time. Now, everyone, please do me a favor, be patient. I will attempt to cover your request as soon as I can. Now, with that being said, let's jump right into some of the concerns with regard to lupus and COVID-19 and how Chinese medicine views and treats lupus. First, I'd like to educate individuals who are unaware as to what lupus is. Now, systemic lupus erythematosus is considered a chronic systemic inflammatory disorder which has alternating exacerbations and remissions of the immune system attacking its own tissues. Now, lupus involves multiple organ systems with systems that are the result of antigen-antibody complex encased within capillaries on visceral structures. Now, there are multiple factors that can contribute to the occurrence of lupus. Now, studies show that lupus tends to be gender and race specific for the most part. Now, this disorder appears to affect women more than men, and women of African descent tend to have a higher morbidity rate relative to other races. Now, females tend to encounter this disorder sometime after reaching puberty and before menopause. Now, exacerbations of the disorder tends to vary from individual to individual. An ominous sign or symptom of lupus is a bilateral red butterfly rash on the cheek area of the face. Now, this rash can be present on other areas of the body when that area is exposed to UV rays. Now, individuals with lupus tend to face a higher risk of infections overall, as well as those with lupus who become infected with COVID-19 generally tend to experience more severe symptoms. So it is extremely important that individuals who have this autoimmune disorder stay in contact with their doctor during a time like this, as well as contact an acupuncturist in your area to see how they can help you better manage this disorder as well. Now, as I've already stated, symptoms tend to vary from individual to individual. The same holds true if an individual with lupus becomes infected with the coronavirus. Now, as I've stated in my other episodes on acupuncture and the coronavirus, I will state again. Symptoms of the coronavirus can appear 2 to 14 days after exposure to the virus, and you must remain cognizant of symptoms such as fever, dry cough, shortness of breath, sore throat, headache, muscle pain, chills, a new loss of taste or smell, general fatigue, and gastrointestinal symptoms such as diarrhea. It has been discovered that in some cases, the infection can have a longer incubation period whereby an individual can pass the virus on to others before symptoms even develop. Now, what's interesting here that some individuals with lupus are unaware of is that fatigue is a symptom of the coronavirus is also a symptom of lupus as well, whereby this virus greatly exacerbates this symptom if an individual with lupus becomes infected. Now, fatigue as a symptom can in some cases be difficult to notice, even when infected with this virus, so it's important that you're super aware of other accompanying symptoms such as fever, difficulty breathing, and a dry cough. Now, some people with lupus are usually on some type of immunosuppressant drug to allow them to better cope with their symptoms. Well, guess what? These drugs can also increase your risk of infection because they tend to suppress your immune function. There are also individuals with lupus who are diabetic and hypertensive. So when you guys get a moment, please go back and watch my episodes on acupuncture, the coronavirus, and diabetes, as well as acupuncture, the coronavirus, and hypertension. Now for the million-dollar question. How does Chinese medicine diagnose and treat individuals with lupus? Now, as a pathogenesis, lupus is closely related to, let's say, excessive heat toxicity with yin deficiency in Chinese medicine. Now, contributing factors include exterior pathogenic factors such as wind, cold, summer heat, dampness, and dryness, and toxic heat invasion of the body. Sunlight, in this case, is considered also a pathogenic factor that exacerbates lupus, as I previously stated. Now, heat toxicity, in this case, injures the blood vessels, whereby qi can no longer contain the blood within the vessels, and blood escapes into the interstitial layers between the skin and muscles and manifests as rashes. Now, blood can also emit into the joints and cause swollen and painful joints. In Chinese medicine, heat toxicity can also attack the internal organs in lupus patients and induce various dysfunctions and symptoms. Another contributing factor can be yin deficiency, which of course includes deficient body fluids of the body. Yin deficiency in this case would lead to an imbalance between nutritive qi and defensive qi, which would increase the susceptibility to exterior pathogens. Now, in my next episode, I will expand further into the analysis of primary symptoms, the basic patterns, as well as pattern progression with regard to lupus as an autoimmune disorder from a Chinese medicine perspective. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?